You're listening to Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Join us as we explore how medical professionals can achieve stellar success in all areas of life. It's time to level up.
Hello, everyone. We're back at Stellar Success Podcast. I'm your host, Dr. Tudor Francu, and I have the pleasure of having someone very interesting from all the way from Dallas, Texas, Dr. Sanjay Doddamani. How are you, Doc?
Nice to meet you.
Nice to meet you too, and I hope the audience will benefit from your insights. So, Sanjay, give us a little bit of overview of your career so far. Where did you start? What did you go through, and where are you now?
Yeah, well, thank you so much for having me on this and for me to be able to share my story. I trained as a cardiologist and have committed the last 2 decades of my career in value-based transformation and healthcare more broadly. But really, the passion has come from helping older, sicker patients. I was a heart failure trained cardiologist working in New York, also serving a medically underserved population, and realized how fragmented and broken things were and how challenging it was, and sometimes frustrating being a provider. And that led me to, be part of the change management movement, if you like, and what can we do? And it started in small ways, like having an open access clinic that could help patients who had challenges with things like medical transportation come at their leisure to an appointment, to be seen rather. And so it was in that rubric of innovation that I said, we can really change the way healthcare is delivered. And I eventually worked at Geisinger, ran the Geisinger at Home medical program, which is a home-based program. I also did heart failure work at a system level, which gave me greater understanding of the integration of payer and provider collaboration, and eventually took my career to the Centers for Medicare and Medicaid Innovation, working on alternative payment models and how the application of payment innovation could actually help drive better care, better quality, and manage a better cost equation. So that's where my career shifted into a more entrepreneurial role in now having been part of 2 startups and leading Guide Health from its infancy of an idea and a laptop to now, serving over 500,000 lives across 4 states.
That's awesome. We're going to talk more about your enterprise. Definitely the value-based model in healthcare right now, it's a sensitive subject, I would say, with a lot of physicians right now. And I'm sure you had a lot of questions about this over the years. And I want to ask you, what do you think your success is based on all these years? Do you have any specific why? Why are you doing this?
I have a very deep passion and appreciate the question. And you talked about successes, but I've also had failures. And each failure actually allows you to build back better, learn from that experience, and apply it almost like fail fast, fail forward, and drive the understanding of the analysis of how to make healthcare better, and even as a professional and as a leader, how to introspect and transform. So it's been a wonderful personal journey, and it's been a great professional journey. There have been some early wins. I think my focus has been relentless on the problem. What are we trying to solve for? Where is it broken? Having a passion with the purpose and applying that here in this case at this time, combining the capabilities we now have with the compassion that healthcare needs to have, in order to really make a meaningful difference in people's lives.
Can you give us an example of such failures or setbacks, I would say, that kind of make you ponder about your success?
Yeah, so I think if you look more broadly, it's also tied to the way value-based care is delivered. Moving very quickly into 2-sided risk without having the infrastructure that you need or the technology assets that you can draw upon. Similarly, having the right set of clinical programs that can actually help engage patients or help improve clinical outcomes, and then being able to scale those at a level that is necessary in order to drive better economics as well as better performance. How to do this without, really challenging certainly the status quo, but without creating the abrasion or without a good understanding of the clinical workflows, or whenever you change the workflows of physicians, you have to be incredibly mindful. Even one extra click is one too many, and so that's where I think there's been a lot of lessons learned.
Yeah, interesting. You also come from, working in this huge organization, right? The Medicare aspect of it, of your career, and going into a private enterprise with your startup. What was the mindset at that time? Because it's a big transition, it's a big transformation, I would say, for someone to go through those changes. It requires a little bit of out of the box thinking, a lot of mindset change. How did it go for you?
It's one of the biggest honors and a badge that I love to wear is service and finding a way to, I think, pay it forward. We don't have enough physicians serving in government. In any capacity, we need to encourage and foster greater collaboration. And so when I was asked to join CMMI and serve as a senior advisor, it was a really great opportunity. It was like duty calling, and I wasn't going to, pass that opportunity. Also to learn about how government can be harnessed to deliver good and to actually drive meaningful change in healthcare. We saw it during the pandemic with the telemedicine waivers that really helped save the day for continuing patient visits. But there's so many other examples of things that we've learned through, the Medicare program and access to data sets and things like that are, housed within the incredible infrastructure and within the largest, essentially, healthcare organization in the world.
Yeah, I agree. Tell us a little bit about your startup, Guide Health.
Yeah, so it's a AI-enabled health services company. We focus on healthcare that includes largely preventive care. But if you were to say, what exactly is the secret sauce? It is an access and patient engagement engine. Essentially, our platform allows us to help with unblocking all the barriers to healthcare delivery, whether it's a referral, an appointment, a scheduling, a coordination, high-risk care management. What's changed is our ability to integrate AI and our health guides into clinical workflows at the practice level, but to have the business intelligence, the actuarial knowledge, and the large data science risk prediction to apply it to the right patient sets. That allows us to move very quickly in addressing the needs and addressing it to the right patients. But most of all, I think the scalability factor, which was previously very challenging and elusive, is now becoming, in the realm of possibility, where previously we struggled to make maybe 5 calls out an hour to, help with a patient issue. Now we can literally have AI agents call 1,000 calls in the hour and have our resources, our people escalate or be available to address any kind of pain points, clinical issues that arise, or other challenges that require it. And that allows a very different way of thinking about this paradigm shift. I like to think of it in VBC 1.0, 2.0, and 3.0. 1.0 was a very restrictive networks HMO era that quickly gave rise to this is not friendly to patients, to a 2.0, which was very labor intensive, very intensive in sort of that model of care. And we see some incredible models that have come out there and are nationally recognized, but I can't necessarily address the entire TAM or total addressable market, are really going to be sort of restricted to, those most at-risk seniors, or really focused on the Medicare and Medicare Advantage population. But what about everyone else? And so how do we get Main Street of America and everyone who's in primary care to have more reprieve, to have better workflows, to have better, patient resources? That's where we are going with our company, our ability to integrate AI and human health guides for medical assistants on an AI chassis to be able to deliver and scale, whether it's preventive care, closing quality gaps, improving patient engagement, doing, supporting providers in their annual wellness visits, or even engaging with high-risk members to help get them their care better coordinated. That's what's a very exciting part of what we do with Guide Health.
Very interesting. I want to kind of relate this business goal that you have with the way physicians look at it. What do you think AI is going to evolve to in this model where physicians and healthcare providers are going to be afraid of having their input, their jobs, their contribution basically to patient care? Because at some point you need to be careful of how much AI can be involved in those type of things, just to kind of avoid, and leave, this human interaction there. How do you see those things evolving?
I go back to reading a book about the emergence of the technology revolution in India as a corollary to how we're going to have this conversation. And that is that when technology and computers first came in, there was huge resistance saying it's going to put people out of jobs. Technology actually created millions of jobs in India that has, been internationally recognized as a place for many, many different functions, from BPO to software to being a leading technology supplier in the world. Similarly, we're not talking anymore about AI replacing doctors. We're talking about AI-assisted physicians and those who don't have those types of resources at the tip of their hands, right? Or the tip of their fingers. So this notion that we can see more patients, there's a major healthcare crisis and a healthcare evolving a crisis and shortage that we're going to face, not just for physicians, but all licensed clinical professionals. 90,000 fewer addiction counselors, 100,000 fewer psychologists, 350,000 fewer nurses, and potentially upwards of 250,000 primary care physicians over the next 10 years. How are we going to solve this? How are we going to meet the challenges of the baby boomer generation? It's not just the patients who make appointments to see you. That is going to be looked at as an archaic way. You have to be able to find the right patients at the right time, provide the right care. And so in order to do that, the old versions of seeking and only seeing a patient in your office is now changed to an omnichannel approach. I'll see a certain initial consult virtually, bring the patients who really need to be seen in the office, or have others also participate in the care. So establishment of the care team, establishment of a care plan, and actually following through on that. That's the parts that get missed these days. Oh, I'm going to double the dose with the patient in a few weeks. No one gets to double it. The patient's back in the ER for some other reason or whatever it is. And so that's where having an integrated workflow solution, that is going to be a game changer for the practicing physician who's already feeling the stress and the near burnout from all of the things they have in front of them. Throwing more lists and throwing more challenges without giving any kind of large scalable solution to helping those caring for patients. That is why we need to adopt this next generation of Gen AI and healthcare technology. We really need to embrace it. And the patients are already starting to react positively to it.
No, yeah, I was about to ask you this. What about from the patient's point of view? Because I imagine, nowadays it's pretty hard to find an appointment with a specialist, where you have to wait, weeks and months to get one. But you're going to have this available through AI. But what about from the patient point of view that wants to talk to a human and wants to see a doctor in person? How are we going to deal with this?
I have a very simplistic view. You cannot replace the human experience. Where do you need it the most, especially in acute care, when clinical decision-making cannot be replaced in terms of that empathy and connection? We have a motto in our company. It's empathy with AI. And that is, it's not one or the other. It's assisting nurses and medical assistants with far broader, more scalable resources so that escalation can include their ability to be part of the care team. So we think of it as an AI agent's also part of the care team.
Yeah.
And the doctor is part of that care team. But now if the patient's having better outcomes, then the doctor spends more time on the things that are very important, like patient engagement, clinical decision-making, shared decision-making, advanced care planning, and really establishing goals with the patient, even after their medical care. Right now, it's a hamster wheel that doesn't allow that to happen. And it's interesting. Patients are reacting in all kinds of really interesting ways. We have a technology partner that we use for our outreach phone calls. And we're noticing that things like depression screening are really better actually assisted with a machine. In other words, an AI agent doing a PHQ-2 is actually less threatening to a patient, where they're very willing to open up about their mood to an AI agent than even to a human being. And so that's where, we're going to unlock new learning through this process. And we need to embrace how we integrate clinical licensed professionals, clinical care team members with AI integration. And that's where we're moving very fast in this area.
Very interesting. Yeah, I'm sure there's a whole lot of things that we don't know yet that we're going to find out when we get to it.
Remember, there's $1 trillion of waste in the United States. Estimates are even potentially even higher. How are we going to reduce low value care? How are we going to get the right appointments? There are some very sick people waiting to see a specialist, but there are also some really overuse of some patients who really should be seen by primary care and not by a specialist. But if we don't have any insights or predictive modeling to understand, or even in real time to assess some kind of a screening, or to be able to provide other alternatives for the lower value care, then we're going to continue to already overburdened healthcare system that we have.
Yeah, absolutely. In your transition from working for the government to your private company, do you think there are any skills or habits that you discover for yourself that help you go through this journey?
I've had an immense personal transformation in understanding things like being present. I've also imagined, things that we're going to do in the future, but remembering and realizing and surrounding myself with very strong folks on the execution side who deliver results very quickly, and we can test out and move on things at a far larger scale and fidelity. So I think that, there are many things positively I learned, both as a clinical provider, as a system leader for integrated delivery systems, health systems, in people management skills, but also in the government to learn of how to manage big data, how to get things moving in environments that have been somewhat different in their timelines. And I was very fortunate that the CMS Innovation Center moves very quickly, and so I learned a tremendous amount about what public-private partnerships look like, or how to stand up programs that the dual, can have applications in the Medicaid space in addition to Medicare, and also more broadly. So I think there's a tremendous amount I've learned across the various roles I've served that are being put into place, or that I'm applying even on a personal level into the work I do today.
Yeah, absolutely. Now, looking at your personal success and try to deconstruct this for the audience, do you have any approach that you do daily in your life? Like how does a day look like in the life of Sanjay to be able to deal with all these issues?
There's a team, and I lead an organization with about 270 employees today. So we are very reliant on one another to make excellent decisions. As a company leader, I meet with my leaders at all levels, but also with frontline staff, as well as with our customers. And, attending and being part of the things they are doing is helping give me better insights as to how we scale success where I see it, and how we move very quickly, including with our technology vendor partners, or with our clinical partners that we are in risk agreements with, so that we're learning from one another very quickly, and we're applying this across our entire geography. Day in my life, I actually start with meditation and yoga, and try to hit the gym at least 4 days a week. And then, have my first meeting every morning at 7 a.m. with my chief operating officer. That grounds me into what we're doing and how we're executing. And then, meet with other leaders, as well as, other constituents. I also have a responsibility to address our fundraising and capital needs. So there are other housekeeping things that are part and parcel of the job of being a CEO. And so I embrace those. But at the same time, I really love spending time with our customers, as well as with our employees across various sections, so that they have a circle of safety, of creativity, of innovation, and are, really enjoying, the joy of being part of a broader care infrastructure.
Yeah, very interesting. It's one of those things of successful people that I've noticed a lot, the way they start their day, on a consistent basis. And meditation is probably one of those things that kind of set you up for success daily. So I would have
a playbook from athletes, from others who are essentially very grounded, and who are using that ability to focus and take it at a very deep level. So I really started this on a very regular basis last year. So it's not like I've been, although I've practiced yoga and some meditation for 2 decades or more, even during my adolescence. It's really now that I'm seeing the benefits of it in my personal life.
Yeah, definitely. So do you think there is an important thing for people like yourself at your level, because people look up to you right now. You're the CEO, you're the chief, you're the boss, but you at your level need to have some kind of mentorship or people that you look up to evolve and grow. How important is this in your life right now?
It is massively important. And the learning doesn't just come from people who are more experienced than me, who are, I have that. I'm surrounded by some incredibly strong leaders, but also advisors and industry colleagues who've been incredible, generous with their time and mentorship. And I'm so grateful. But I learned so much now from our frontline staff, from our directors. I love to hear how they're addressing things and to take that knowledge and to take that learning and to apply it in different places. And that, I think, is a combination of, stripes that I wear when I, and I don't look at the role of the CEO as one to look up to. Certainly, I need to shine the torch, if you like, and have that true north. In fact, Guide Health, the logo for us is a star. It's a constant reminder to me every day that we have a true north. Don't forget what we're trying to do. We're trying to solve some of the greatest challenges in healthcare. And that, is a very important guiding light to me. Hence this name, Guide Health. It's constantly guiding us to innovate and to be focused on, making meaningful changes to patients' lives. So I have that. There's also a divine element that, we all should have some levels of appreciation of our, internal barometer. You can call it faith. But to me, it's, I think, that grounding that's allowing me to take in a lot of learning very rapidly. This field is also evolving very rapidly. So I'm learning from all areas and all leaders, including outside of healthcare, in order to be effective in my role as the CEO.
If you would, with all your experience so far, if you would have a chance of talking to your younger self 20, 30 years ago, what kind of advice would you give?
Oh, that's a wonderful question that I hope doesn't stump me. I would say be true to yourself and speak up. And don't be afraid to confront change, embrace it. That is a vital part, I think, of my learning. And all the rest will follow. The economics will follow. But if you sense something is wrong or something is, not working, don't just stay complacent in it. It's almost better to make a change and make it very quickly. But it's most that I have been fortunate is my inner voice. And that has kept me, I think, very much focused on what's important in life, and all the rest of it follows. But if you lose focus of that, you lose your values, you lose your core, then you get on shaky ground.
Yeah, that's very well said. How can someone get in touch with you, know more about your work and your projects?
I am actually very available to people. My email is firstname.lastname@guidehealth.com. On LinkedIn, there are all kinds of people who reach out to me. I've purposely kept that network open. It's because there are students who are looking to get into healthcare. There are, medical graduates who want to know how to, where to start if they want to go into innovation. So I've always kept that line open. I learn a lot from, them in their current times and what challenges they're facing. Even young doctors, for example, reach out to me all the time. So it's easy to connect with me. And, the hard part is how to organize my day now, given all of these things. But that has not, been an obstruction for me to be able to connect with people. I learn a lot from those interactions, and they actually help us drive a better company.
That's awesome. Well, it's been a pleasure having you on the show, and I hope the audience will reach out because you're a wealth of knowledge in this field. So wish you good luck, and hopefully we'll reach out back to you and see where you are soon.
Tudor, it's been an honor and pleasure. Thank you so much for having me on your program.
Absolutely. Thank you.
That's a wrap on Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Interested in joining us? Go to stellarsuccesspodcast.com/guest to apply. Stay stellar and level up.